We're here today first and foremost to reassure Canadians that the Public Health Agency of Canada advises that the risk still remains very low, and we have strong measures in place to protect Canadians. The Ebola virus does not spread easily from person to person. Canada is very well prepared with a number of systems in place to identify and prevent the spread of serious infectious diseases like Ebola. In the chance there are suspected cases, we can quickly test and take appropriate action. In Canada, we are extremely fortunate that we have some of the best hospitals in the world. If there was ever a confirmed case of Ebola in Canada, the Public Health Agency would immediately advise the public and ensure all appropriate precautions are taken to protect Canadians.
We spent a lot of time training our Canadian Border Service agents, and they're designated through the Quarantine Act as agents of the government to enforce the Quarantine Act. We've also spent a lot of time training the airlines and training some of the folks on board. So from the airline's perspective, if they identify a sick traveler, the pilot radios ahead, and the quarantine officer will actually board the plane and meet the traveler on the plane. Given that the incubation period is from 2 to 21 days, meaning by the time a person is exposed to the virus, it may take up to 21 days for the person to be symptomatic. That is exactly what happened in the U.S. case. When the person traveled on the plane and first entered the country, the person had no symptoms. We have a very limited supply of vaccine. We only have this time, as I mentioned, 1,500 doses totally, and some of that has been used for research purposes to ensure the vaccine is safe. The company is producing more. There should be more vaccine available toward the end of December, early January and 2015 is my understanding. So part of the messaging we're giving to practitioners at the front lines, and that is through our colleagues at the provincial and territorial, is messaging around be aware and ask a person, have they had any recent travel to Africa? The CBSA, if a person is coming from that area, have a little reminder in the computer screen, and they ask a question, are you ill? If the person says yes, then they're referred immediately to the quarantine officers for a full assessment. For those coming from Africa, they are specifically asking a question, are you ill at the border? If there are any passengers who are ill, appear ill, or have reported being in contact with somebody who's ill, they are referred to our quarantine officers who do a full medical assessment.